All right, everyone, thanks for joining us for this presentation, which is about accessing healthcare. And we're joined today by Anastasia Alexandrovskaya, who works for CAPS and the Health Center at UC Santa Cruz, and she will introduce herself next.
Thank you, Lisa. Hi, everyone. My name is Anastasia, and I am a case manager and therapist that works at the Student Health Center in CAPS. And my contact information is right there, phone number 459-1383, and there's my email. And today I'm just going to go over what the best way to access healthcare, whether that's on campus or off campus, as well as mental health care. So I'm going to jump right on in. So what do you do if you are sick or injured? So we do have same day care at the Student Health Center. And what we recommend is to actually give us a call before you come in, even if it is a same day care situation. So you can call us at the front desk, which is 831-459-2211. And this will save you time of waiting when you get here too. We can actually ask you to come in at a specific time to make sure that you're not waiting too long to get seen. And so the types of things that you can come in for same day care is you just wake up feeling sick. You wake up, you have a sore throat, your stomach is hurting, you're sneezing or having some cold symptoms. You might also have an injury. You might have fallen, a head injury, a cut from an accident. You might have a rash. Some of you will find out that in Santa Cruz, we do have a poisonous plant called poison oak. And when you touch it, it does give you a rash. That's something common that students might get. Or any other acute, which basically means not chronic long-term symptoms. All of those things you can be seen at same day care with us. And so the health center is located at 1156 High Street, and that is across the street from College 9 and 10. And we are open from 8:30 a.m. to 5 p.m. Monday through Friday. After calling, you'll be scheduled to come in for a visit. And like I mentioned, they'll let you know what time to come so you don't have to wait too long. And we do offer both in-person and telehealth appointments. So the person that you talk to on the phone can help you decide which one of those appointments makes more sense for you in the moment. If it is an emergency, so if you have a loss of consciousness, a broken bone, difficulty breathing, please call 911. That is the service that will get you an ambulance to an emergency room to get emergency care. At same day care, we do have pharmacy, lab, and x-ray available on site as well. If you are needing routine care, the process is pretty similar. So we want you to call and schedule at our front desk. And I do want you to know that telehealth is available for students residing in California. So if you are currently studying somewhere not locally and you just want a telehealth appointment, as long as you're in California, we are able to accommodate that. And the kinds of things that you would come to routine care for is annual physicals, sport physicals, any chronic issues. So things that you already have a diagnosis for that just need some routine checkups for. Medication management, if you're needing refills on medication that has been prescribed to you in the past, or referrals for off-campus specialists. So if you are looking to see somebody for skin issues, for a dermatologist, if you need a chiropractor for some back pain, acupuncture, cardiology, any of those things, we do want you to call us first in order to do a referral. So regardless of what your insurance is, most insurances have a referral process. And for UC SHIP, in order to be seen off campus for anything, we do need you to have at least a telehealth appointment first in order to get a referral to get off campus. And a lot of those can be done over telehealth. And so when thinking about visiting the health center on campus, if you have UC SHIP insurance, there is no fee for your visit. All lab tests and x-rays that are done at UCSC are also $0. Some tests have to be sent off campus, and those tests would have a 15% coinsurance fee, and they would let you know which tests those are. And medication, like I mentioned, we have a pharmacy on site, and generic brands only have a $5 copay. Some brand name brands will have a $25 copay, and this is for a 30-day supply of medication. There's also a couple of other options that are not usually come up, but there's some non-formulary and so specialty medications that might be a little bit more, but for the most part, the medication that we will prescribe here that you can pick up at the pharmacy will just have a $5 copay. Cruise care. So for students that do not have UC ship insurance, so if you waived UC ship and you have any other kind of insurance, but you wake up feeling sick and you want to be seen on campus, we definitely recommend for you in that situation to get cruise care coverage. So cruise care will allow you to be seen for a same day care appointment. So remember, those are things that you might wake up feeling sick, have an injury or a rash, anything like that. Cruise care will cover you being able to come in for the in-person visit without a copay. It'll cover lab tests and x-rays that are done in-house, like I mentioned, not the ones that we send out for non-urgent reasons. For example, testosterone check, blood type check, those kinds of things are not covered, but a lot of the things that you would come in for same-day care will be covered by cruise care. If you are not currently signed up for cruise care, and you come into the student health center, the front desk will actually help you figure out how to sign up for cruise care on the spot. So just so you know, if you don't have cruise care, you get sick, you need to come be seen on campus, we will help you sign up for cruise care in order to get that coverage that day. That's always an option. So this is a helpful visual to kind of help you understand why sign up for cruise care, why UC ship is really beneficial. So this is 3 different people with different kinds of coverage that come into the student health center for a sore throat. So like I mentioned, a UC ship student that comes in will not pay for the office visit. They won't pay for the lab test, but they might have to pay for a throat culture from an outside lab. So sometimes like end of day Friday, if we cannot run the test here, we might send it out. So for example, this student, we had to send out that $51 lab test, and the student will only owe 15% of that lab test because it's the co-insurance fee. So Alex gets to leave that appointment paying $7.65 plus that $5 pharmacy prescription for his sore throat. Tyler, the one on the right-hand side, came in and let's say he signed up for cruise care because he found out that he was going to get some costs. So Tyler also pays $0 for all of those things, but then has to pay the total of $51 for the off-campus lab test. And then however much that he's going to pay for the medication, because he won't be able to get that. Cruise care does not cover medication. Cruise care only covers the visits. And Jen, who is someone that came with private insurance, but has not signed up for cruise care and has decided not to sign up for cruise care, will owe $329. And this is because any office visit that you would get on campus or off campus already has a cost just by being seen at any medical center. And so just by being seen, Jen is already going to owe $206. So this is why we really encourage to have UC ship. And then if you don't, please sign up for cruise care because we don't want you to accrue all of those costs. So off-campus care. So as I mentioned, you are able to get referrals to be seen off campus. So if you're a student that lives off campus and or you need a referral for a specialist, you are able to access what we call in-network providers off campus. And that's for primary care, psychiatry, specialists, therapists, all of those things, after getting a referral from a UCSC clinician. So this is when you would want to call and schedule an appointment to get a referral. In-network providers will have a $10 copay for visit. So this is just for the visit. So if you go to see a provider off campus, there is a $10 copay for the visit with them. Aside from therapy, which actually has, for the first time, a $0 copay. So if you do get connected to a long-term therapist off campus, there is currently no copay with UC ship, which is very exciting. And I will show you at the very end of the presentation how you would look up off-campus providers. So you kind of have a sense on what the process is to find somebody that is in network. If you do end up accidentally, for whatever reason, seeing an out-of-network provider, so somebody that does not accept UC ship insurance, which is Anthem insurance, there is a way to get reimbursed for part of that cost. And that is something that we have information on our website on how to do, or myself as a case manager can help you navigate. So if that ever happens, feel free to reach out to me and I'll help you find out how you can get reimbursed for part of the costs that you had accrued. Private insurance. So all of you students that decided to waive UC-SHIP and are coming with your own private insurance plan. So the coverage locations and prices depend on your insurance provider. So to locate the providers that are covered by your private insurance, you want to either call the number on the insurance card that they gave you, if they gave you a physical card, or visit their website. There should then be a way, which like I will demonstrate how to do it with UC-SHIP. It should have a similar process to whatever your insurance provider is. And to keep in mind, you will likely have co-payments for all visit types and other out-of-pocket costs with your insurance provider. UC-SHIP and the health center are kind of the only ones that don't really have a copay for a lot of the services that we have. I also want you to keep in mind that there is often a wait to get connected to an off-campus provider. So calling to get scheduled ahead of time is good practice. Sometimes you can't get a specialist appointment unless you have established care with a health center. So if you have come to UCSC with a different insurance plan, I do recommend getting connected as soon as you can to a provider in order to then access any kind of care that you might need while you are here with us. And then on to therapy and psychiatry. So on campus, we have CAPS, which is Counseling and Psychological Services, and they are located just across the health center, across the bridge upstairs from the health center. So you can find us at the same physical location. And CAPS is open 8 to 5, Monday through Friday. We do have an after hours and weekend crisis line that is available at the same phone number as you would call during business hours. You would just click 3 after you dial in. And so what services do we have available? We have individual counseling, which is focused on short-term therapy. The average is about 2 to 6 sessions. And the way that you get connected is you would call to schedule an IA or an initial assessment. And again, you would call at that general line to get connected. We also have groups, all sorts of different really helpful groups. We have psychoeducational groups such as the Anxiety Toolbox and the Mood Toolbox. And what those do is really teach you some skills on how to manage stress, how to manage anxiety, how to manage low mood, depressed mood. And you would do that in a group setting over 3 weeks. So you would have a session every week for 3 weeks. We also have process groups, which go for the entire quarter. And sometimes we will keep the same people in multiple quarter groups, which are like a general support group, healing after sexual assault, understanding myself and others, undergraduate and graduate women's groups, all sorts of different topics that you can find on the CAPS website under the group schedule tab. What we also have is drop-in groups. So the groups that I mentioned before, you would have to sign up for, you would have to call and ask to sign up for those groups. But there's also drop-in groups. If you wake up and you're not feeling great and you just need to talk to somebody, we do have a group that's called Stressed Out Drop-In and is currently held over Zoom. So again, if you go to our group schedule, you can find the Zoom link and just drop in and talk about what it is that you're feeling. Or if you just kind of want to sit back and listen to other people talk and feel part of the community, that we're all stressed out. And sometimes, points in the quarter can get really challenging. We also have a 30-minute mindfulness group. So if you just need some time to center yourself and have somebody guide you through a meditation mindfulness group, this is a great option. All of these things that I just talked about are available free of charge to students, regardless of insurance coverage. So whether you have UC-SHIP, any other insurance, it doesn't matter. All of these services are available to you at no charge. We also have psychiatry services. So psychiatry is medication management and initiation. So whether you are coming with medication or if you're just interested to see if medication can be something supportive for you to deal with mental health, behavioral health, then this is an option. If you have UC-SHIP insurance, psychiatry is free of charge. We do charge that $90 and $35 to the insurance, but that is not something that you would pay out of pocket. If you have a different insurance, you would be responsible for the $90 for the first appointment where they would do the evaluation, and then for $35 for follow-up visits. And something to note, because this comes up a lot, UCSC Psychiatry does not do evaluations for ADHD and will only prescribe medication for ADHD if there's a full evaluation done off campus in the last 3 years. So that's just something important to keep in mind. We do have psychiatrists out in the community that do not require the full evaluation, but if you are wanting that on campus, please keep in mind that you would have to get that assessment done. And then therapy and psychiatry off campus. So as I mentioned before, therapy with UC SHIP, there are no copays for off campus, which is very exciting for therapists that are in network. And therapy off campus is also different because you can see a provider ongoing. There's no limit on sessions. The referral that we do for you is good for the academic year. So it's really up to you and your therapist how long you continue seeing each other. While on campus, we focus on a more brief model in order to be able to see as many students as we can and offer them support. And also with telehealth, this means you can see any provider in California for Zoom or phone sessions. And this is especially great for some of our international students because it can be easier to find a provider that speaks your native language. So if you find yourself in a place when you're wanting mental health support, but you would really like to see somebody that you can feel more comfortable with talking in your native language or align with you culturally, again, please reach out to me and I can help you to try to find somebody that is in California and might speak your language and take our insurance. And then for non-UC SHIP students, if you are seeking therapy off campus, again, it just depends on what your coverage is. All plans, hopefully, if you waived your UC SHIP insurance, should have a mental health component to them. But therapy will, I say often, but pretty much always have some sort of copay, which is usually between $10 and $25 per session. Searching for off-campus providers. So I know I mentioned this a couple of times, and I wanted to make sure that I actually walk you through what that might look like. So every insurance provider, and for us with UC SHIP, that's actually called Anthem. You can go to their website in order to find a list of providers of all sorts that are considered in network. So for UC SHIP, you can even Google Anthem Find Care and it'll bring you to this website. Once you get onto the website, and I can actually, let's see if I have mastered my ability to do this, might be able to click to get there, might not. If I don't get there, just know that you can go on there and it will ask you to do as a member, and you are a member, is to type in your ID prefix. And so for all UC SHIP and students, your prefix is XDP. So once you type in XDP, it'll bring you to this new screen where you can search by location and what kind of provider you want. So you type in Santa Cruz, California, and then if you're looking for therapy or psychiatry, you choose behavioral health. If you're looking for an urgent care because it's Saturday and you need to be seen today because you're not feeling well, then you would click urgent care. If you're looking for a specialist, there's a button for specialists and you can look up chiropractor. So it's not going to go there right now. It's just going to give me the circle of death. But hopefully that's helpful and you know how to get there. And this is also the same process that you should be able to use for whatever your health insurance is. If it's not UC SHIP, whatever the name of the insurance is, you can look up their website and it'll help you search by area and then by what it is that you are looking for. And that's about it. Thank you for being here today. And remember, my contact information, if I can go all the way back to the beginning, is right here. And feel free to reach out to me if you have any other questions.
Anastasia, thank you so much. This is really helpful. I wanted to just add that 1156 High Street is the address for the whole university. And so it's important to know that, yeah, it's our address too, actually. So it's important to know that the Student Health Center is a large building. It's across from College 9 and 10, as Anastasia said. So there's a shuttle stop and a bus stop right in front of it, but it's at the top of campus if you need to go there. on the
Thank
loop.
you, Lisa.
Yes. All right. So on behalf of Global Programming, thank you so much for being with us today, Anastasia. We really appreciate it. And she's fabulous. If you need help, she's a great person to contact with anything related to health, mental health, and the health center. So thank you, Anastasia. Have a great afternoon, everybody. Take care.